Without further delay, I'll turn it over to Marlise Perez to begin.
Thank you so much, Megan, and welcome to our Engaging in the BHSA, Behavioral Health Services Act, community planning process. My name is Marlise Perez, and I'm here at DHCS as the Behavioral Health Transformation Project Executive, and I also oversee our Community Services Division. So really excited to have you here today, whether you're tuning in live or watching this recorded webinar. Next slide. So Megan already talked a little bit about the housekeeping items, but just also want to draw you to the last point here on the slide is we will be posting this slide deck within the next 10 business days. It will be on our larger BHT webpage at DHCS, and also we'll have the recording posted as well. And so today we're really focusing on how our community partners and stakeholders can engage in the local community planning process for Behavioral Health Services Act. So we're just going to touch a little bit on a quick little recap around behavioral health transformation. Also going to talk very briefly about the integrated plan, just in case folks aren't aware of some of the overarching requirements, especially around community engagement. Then we're going to talk about that community planning process. We're also going to talk about data and that approach there as well. And then also how you can stay involved in the community planning. We also want to make sure that you're aware of, after that community planning process, other engagement opportunities and then resources. And before we move forward, I do just want to highlight that throughout the presentation today, we have designated certain slides as resource slides. And so these, I'll highlight these and walk you through all these, but these are really kind of some homework assignments for you if you want to learn a little bit more about that topic. And it's going to take you to other resources that can help you get better informed and be able to then engage in a more meaningful way in your local planning process. Next slide. All right, we can move to the next slide. And if you've been around for any of our presentations here at DHCS, this slide must look very familiar to you, but I do need to just quickly level set and remind everybody that back in March of 2024 is when Proposition 1 was passed. It's really brought together two bills here, the first being the Behavioral Health Services Act that we're talking about today, and the second being around the Behavioral Health Bond. And so if you are new to this space, I'd highly encourage you, we have some information on our website, but you can learn a little bit more about the changes that were brought on by both of these bills and the larger proposition in general. Next slide. And so just really important for you also to know that the Behavioral Health Services Act really intersects with other behavioral health initiatives that have been stood up here at DHCS. And so these have been highlighted in some of our materials. Would encourage you, if you haven't already, just to kind of click on them, learn a little bit more about how these intersect. And if you're a little bit more familiar with the behavioral health space, you'll recognize where these initiatives connect in. But most importantly, what I want you to kind of walk away with today is these initiatives and others that we've stood up at DHCS really help bring forward additional federal funding in the behavioral health space. And they also, as we've been developing out the policy around the BHSA, really making sure that we have alignment with our other initiatives as well. And we'll be continuing to do that because behavioral health transformation is not a one and done type of program. It really is an ongoing effort. So as new initiatives come on the scene here in California, they'll be folded in to the work being done in this space. Next slide. All right, so here's your first resource slide. So one area, if you are a stakeholder or partner that's really interested in the full service partnership, and you'll know that we have a lot of evidence-based practices that are required to be lifted up under the full service partnership bucket. We have a great FAQ that really talks about how those requirements also overlap and intersect with our BH Connect waiver. So there's a lot of great questions there if you're interested in learning more about this overlap. And for those of you that aren't familiar with our BH Connect waiver, this will help get you familiar with that opportunity. And then there's, of course, back on the other slide I was on, other resources so you can see updates on the rollout as that continues in California. Next. All right, so this is once again another kind of framing slide that hopefully most of you already are aware of. But with the Behavioral Health Services Act, that of course reforms the Mental Health Services Act, and one of the main areas that it changes is how funding is allocated at the local level into these three components of housing interventions, which is a brand new component, full service partnership, and then the last component, the behavioral health services and supports. If you're interested in learning a little bit more about those funding sources, we once again also have a lot of different FAQs and resources on our website where you can tap in there. And then, of course, just always want to frame out around BHSA, there are priority populations that the law requires us to focus on with this funding. And you'll see these here set out among adults and then among children and youth. Next slide. And so, as we've been implementing BHSA over the last year and a half or longer here, we have a new document that we just recently have available, and I have the link on one of the next slides. But really want to make sure as you are engaging in that local community planning process that you really understand the overall the intent when this was being developed. And so one of the pieces here is really that the BHSA, the funding stayed the same from the tax base, that millionaire's tax for 1% for million of anyone that makes over $1 million. Sorry about that. We always call that the millionaire's tax. But there wasn't any cuts made to that funding. But really what it did is it shifted where that funding is to be expended. And so it really is focusing on helping those that are most seriously ill and unhoused. And so also a big change was really increasing accountability for our county partners and also the state in achieving these results. And so just really want to recognize that some of these changes, that can be really hard. And so some local funding at the local service level may see funding decreases or shifting to another source, and then to other services as well. But then that increases the focus on other services, like I just mentioned, housing being one of them. So this is just a chart here that talks a little bit, just as a snapshot point in time, to really demonstrate over the last several years how funding overall for behavioral health has been increasing in California. Next slide. And so that slide before that, just a little snippet there, that is a part of our new resource here. So if you haven't seen this, I'd really encourage you to check it out. It's Understanding the BHSA, the Myths versus the Reality. And so we've really worked on just gathering up some of the things that we've been hearing and really just putting some reality around that and some other resources that you can check out. So I'd really encourage you to look at that. It is posted on our website here at this link. And some of the topics are around funding, like I just mentioned, one of them, also around provider and system capacity, stakeholder engagement, and then just generally around behavioral health services. And so once again, this little graphic here on the right is just showing you another one of the myths versus the reality that we have posted at this resource. Next slide. And so really the goal of the Behavioral Health Services Act is to create a more effective and integrated system. We are not setting out to dismantle existing services. And part of that is the development of this 3-year plan. And this 3-year plan encompassing all of the behavioral health funding that counties receive. And then really looking at that plan across the whole continuum of prevention, early intervention, and intensive services across, once again, not just those BHSA services, which were formerly MHSA, but also all of the other funding sources, as some are listed here, our substance abuse and mental health services, our Medi-Cal opioid settlement fund, realignment funds, all of those funding sources. And then counties need to prioritize services based on the local needs and be informed by stakeholder engagement. And once again, that's through the community planning process, which is what we're talking about today in this webinar. Next slide. All right, so just talking about that integrated plan, I just want to make sure that everybody really has a baseline understanding of what that integrated plan is. And so once again, it's to collect that local information on planned behavioral health services. And so this is for all of our counties and then also our cities that participate in BHSA. And once again, the goal is to increase that transparency and accountability in not only the reporting, but really ensuring that counties are effectively using the federal dollars. And once again, this is the plan. Later on, once we have it developed, we'll be talking about that reporting mechanism, which is known as what we call the BODR, but that's the Behavioral Health Outcomes and Accountability Transparency Report. That's going to be actual expenditures. What we're talking about today, once again, is planned services and expenditures. So counties have to develop these every 3 years. And then once again, as I mentioned earlier, that counties have to submit a budget. And it's across both the mental health and substance use disorder care continuums, across those prevention, treatment, recovery services, all of those key elements. Next slide. And so really the goal of having these integrated plans, there's really quite a few goals for our county partners is really to help them understand the capacity that they have locally to be able to serve, but also their capacity with their finances and what they're able, what needs they're able to meet. Also to really be helping continue to move forward and integrating that program, planning those services that are delivered locally, really helping them, establish these or continue outcome metrics that are in alignment with our measures that we've been developing with our stakeholders, and then also really being able to leverage that local county reporting and monitoring. And then for our other stakeholders, really giving you a lens into transparency about the county's progress towards reaching the behavioral health goals that I'll talk about in just a minute. And then also how funding is allocated out among those different funding sources at the county level. And then, of course, an opportunity to provide feedback and really meaningfully engage in the local priorities. Next slide. So here's another resource. I just want to highlight this for you. We just recently put this together, but just really this here has just a brief explanation of all of the different funding sources that county partners receive from DHCS. And there are also on this resource, there are further links that can help you learn even more if you want to learn more about the particular funding sources that we have mentioned here. So this is another great place if you're newer to the system to really understand the different requirements, because all of these funding sources do have different requirements that our county partners have to operate within as well. Next slide. This is also another resource, and just want to highlight we at the department publish annually the amount of prudent reserve. And so what prudent reserve is as we're talking about BHSA funding and formerly MHSA, counties are permitted to have a certain level of prudent reserve, and that is dependent on their county size. This prudent reserve level has changed with the BHSA, so just want to note that. And our county partners are required to put into their integrated plan how they're expending their prudent reserve, especially if they are over the cap that's allowable they have to be placing that in their integrated plan. So if you are a local partner and you want to learn about what your county, what level that they have, you can use this resource and learn a little bit more about that. Next slide. So this here is just the timeline for the integrated plan. This one highlights just our current process for this first integrated plan for BHSA. And of course, this cycle continues every 3 years. But you'll see here on the left, we are in the active stakeholder engagement phase. You'll see here the first draft is due to the department March 31st. And then we'll talk a little bit about some of the components there and other folks that need to be approving and reviewing this plan. I'll talk about that in a subsequent slide. But then the final plan is due to the department no later than June 30th of 2026. And then the integrated plans go into effect. Next slide. All right, next slide. And so, as hopefully most of you already know, there are requirements in the law around what it means to have meaningful engagement with stakeholders. And so these are the codes in the Health and Safety Code and the right here, the different, if you want to go and actually read the statute, but basically stakeholders need to be consulted with that integrated plan. And then any type of allocation percentage changes, and then the plan for expenditure of funds exceeding that prudent reserve that I just mentioned on a few slides back. And so once again, this is to ensure that there's transparency into how counties are using the behavioral health funding. Next slide. And so there have been some key changes to the community planning process because this planning process has been around since the initial implementation of MHSA over 20 years ago. But some of those changes are there's some key stakeholders that are required now to be a part of this planning process. And so you'll see here some of the key stakeholder groups that have been added. We have listed here, but all of the stakeholders are outlined in statute if you want to see if you are a required stakeholder. However, if you are not on that required list, that does not mean you cannot participate. It just means that counties have to ensure that the required stakeholders are present for the stakeholder engagement. Next slide. So there's lots of various methods of engagement. And so these are just some examples of local involvement and engagement that can be included as counties are moving through this process. Next slide. So here we are again at another resource slide. So we have contracted and put together through Cal Mesa. They have assisted us in putting together this meaningful engagement guide to the local community planning process for counties. So while this is written for our county partners to help them structure the community planning process, I've heard from other stakeholders that have reviewed it and found it to be helpful. So if this is something that you're interested in reviewing, we also have a webinar that was conducted that kind of walks you through this guide. You're welcome to view that as well. It really has a lot of that detail around the timelines, the processes, has a lot of recommendations too on all of those ways on that prior slide to engage stakeholders. So once again, just a resource for our county partners as they are planning this out. Next slide. So along with that, counties may, the statute allows counties to allocate up to 5% of funds to support stakeholder engagement. And so hopefully most of you know we have our county policy manual, and that actually lays out all of our guidance. It really acts as our regulations. And in there, we have also included this information on how this funding can be used to support stakeholder engagement. So you'll see here it can be utilized around staffing and training, any sort of costs around actually doing the planning, and then any type of stakeholder support. Next slide. We also, here we are again at another resource. I'm going to be saying that a lot in the webinar, so just be prepared. But if you haven't seen this yet, we just prepared a quick reference guide about the community planning process and local stakeholder engagement. And so this is really a great infographic that you can provide to maybe you are here representing a organization and you want others to learn about this planning process. This is a great guide that can kind of help you in a short, quick way talk about the planning process. You'll actually see here on the front part here on the left, it actually lists out all of those required stakeholders that I was kind of mentioning. That's included there. And it also has how to connect locally. And I have that link that I'm going to share in just a moment, but that is also contained on this infographic. Next slide. So another resource. So there's a lot of other ways that you can, maybe as a stakeholder, you're not very familiar with what is in the integrated plan and you want to learn about the requirements. There's a lot of different ways that you can do that. One of the ways is we have the integrated plan template that is a part of the policy manual. You could look through that. That actually has all of the questions that counties have to provide to DHCS. We also have some FAQs to help our counties understand, how to complete the plan. Also, they're submitting this through a county portal, and there's resources that help guide them, whether it's through this FAQ, but we also have some recorded webinars that kind of walk them through, once again, the requirements, but we also have a lot of webinars to help them actually utilize the new portal to where they're submitting their integrated plan. And then we also have a integrated plan budget manual. And this is once again just some step-by-step instructions for our counties around the timelines and then how to submit those items in the budget. So if this is of interest to you, this is available and all the links here are available. And these are also all available on our website. So you don't have to wait for us to post this slide deck. All of these resources are currently available on our DHCS website. Next slide. All right, so here is another resource that we have available. So as I mentioned, that integrated plan is our county partners are having to plan across those care continuums that I spoke about. So we have two different care continuums. One is for the substance use disorder framework, and the other is for mental health. And you'll see here just a little small example, but right, the first one here around primary prevention services. So we have a little definition of that service category, and then we talk about the funding sources that counties can use in that space. But it really is to help walk them through with all of those various funding sources and the allowability where they can put in their care continuum that they're submitting to us, all those different resources and help them plan that out across that care continuum. If you are not a county and you're a stakeholder and you just want to learn, once again, a little bit more about all of the different requirements of these funding sources, this is another great resource just to help get you educated about how our counties can use these different funding sources in these different categories. And it'll help you get a little bit more familiar with what's available to them and also what's not available to them because not all funding sources that they're provided can be utilized across the whole care continuum. Next slide. Okay, so next, just really want to talk about as the counties are really approaching and planning out their integrated plan, one of the key components of BHSA is around these statewide behavioral health goals. And so, and once again, all of this is contained, all this policy in our policy manual. So if you want to learn a little bit more about that, here's the link in the right-hand corner, and it'll take you to the policy manual. But so we have these 14 statewide behavioral health goals. And so in the integrated plan, our county partners have to be talking about how they're going to be meeting these goals. And if we move to the next slide, how they're going to be doing that is through the population level behavioral health measures. And so for this first integrated plan, we have already released our phase 1 measures, and these are population level measures. And so I do just want to make sure everybody understands that our county partners can't meet the whole population measure because there's others entities that also are responsible for that, but it really gives them at least some guideposts and some goals that they can attain to, or they can see how they are kind of ranking across the state, or areas where they may have some gaps. And so you're going to see with this, each of these goals has primary measures and then supplemental measures. And so once again, we have a tremendous amount of information on this. If this is your first time hearing about that, we have some resources I'll be talking about that can help bring you up to speed. Next slide. And so when counties are really looking at moving forward with the planning around the data, once again, there is a workbook, and we'll have the link here if you haven't seen that already, that has all these 14 different goals and across these measures that I just spoke about. We have identified that our county partners have to address the 6 priority goals that we've laid out, and then at least one additional goal to work toward. And then that self-selected goal, counties have to work with their partners at the local level based on community needs and stakeholder input. That doesn't mean that counties can't do more than these goals, but these are the minimum requirements. And then you'll see here on the right, this is just an example of what our counties are going to have to be providing to us in the integrated plan. And you'll see there's information around identifying disparities and then how they're choosing data-informed strategies to improve these outcomes. And so once again, if you're interested in that, I highly recommend that you look at that integrated plan template because it has all of these questions laid out, and you can see, once again, what the counties are going to be providing back to DHCS. Next slide. So if you are, wanting to engage locally, we have some steps here that you could take, especially around this data and this part of the integrated plan. And the first step would be to review and analyze your county's data that we have in that workbook. And all of that is contained there, and you can get familiar across those 14 goals and across those measures where your county partners are now. And then the second step is, of course, engaging in that community collaboration, and then really helping to develop those data-informed strategies. Next slide. So maybe you're not as familiar with some of the different data and you want to learn a little bit more about that. DHCS also commissioned CalMesa to create this data explainer series. And so it was 10 weeks of an incredible series of really taking all of these different data sources and helping walk through and explaining and providing that education. So once again, this is a resource that is already available. Would really encourage you, if this is once again an area maybe you don't know as much about or you want to learn more, this is another great resource. There was also some corresponding office hours that really helped counties learn how to incorporate these goals into their integrated plans, and then also to really be strengthening that data-informed strategies. So once again, those are also available. Maybe you're just interested in one goal in particular, whatever. That is all available for you to review. Next slide. And so the last thing I've been mentioning a lot about is that measures workbook. So this is just a link to that. So highly would encourage you, if you haven't already, to be really getting educated around what your local county is doing in that space. There's also some measure instructions and other notes that would help kind of guide you in learning a little bit about how that was either compiled, what data sources, all of those type of things are available for you as well. Next slide. All right. So, also have just some tips here of how to plan and prepare for community planning. And first is that preparing. And so, once again, we have all available resources that I'm discussing today that are available on our website. Also, just really as you come forward to those discussions, understanding the expectations for the various stakeholder groups that you belong to, and really ensuring that you have your feedback ready to help the counties. There is a lot for our county partners to be lifting up, so recognizing that is a lot. So the more prepared you are, that's going to assist them as well. The next is to connect in. As I mentioned before, each county has a BHSA, currently MHSA, but a BHSA coordinator. And so would encourage you to connect with them to find out where they are in the community planning process, where you can find information, and then any of the upcoming activities. And so we have here the list of the county coordinators that is also posted on our website. But this is a great resource so you can get connected locally and engaged in if you aren't already. And then the last is, of course, to engage. I do want to just highlight that community engagement. This is an ongoing process. While we are talking about the first integrated plan today, this is going to be a continuing requirement for our county partners. So just to plan to stay engaged over time. Of course, focusing on the needs of your local area or whatever it is that's bringing you to the table around behavioral health. And then, of course, as we mentioned, and accessing the resources to learn more about the BHSA so you can come equipped and ready to engage. Next slide. All right, so just also really want to make sure, I kind of mentioned earlier, we're talking obviously a lot about stakeholders engaging locally in the planning process, but really want to make sure that you understand that after that engagement has occurred, our county partners are required to circulate their integrated plan for public comment. There also has to have a public hearing with their local behavioral health board where feedback is incorporated. And then the integrated plan, the final integrated plan, has to be approved by the County Board of Supervisors. Next slide. So for all of these, just quickly want to break down some of the requirements around each of these. And the first around the public comment is, as I mentioned, it has to be the integrated plan circulated for at least 30 days. That is to representatives of stakeholder interests or to anybody that requests a copy of it. And it's really up to the counties of whether they circulate this integrated plan before or after they submit the draft to DHCS. However, it has to be submitted prior to the final coming to DHCS, and they have to explain that to us when they make the submission as well. Next. As I mentioned, they also have to bring it before the local behavioral health board and have a public hearing. And so they have to, at the close of that 30-day comment period, they need to have a public hearing. If you're unfamiliar with who is or where your local behavioral health board is, we have the link here that you can link in and find out about that as well. And this webpage just provides the schedule of the local behavioral health board meetings by county. And then sorry, go back really quick. Once that plan is ready for the public comment, the Behavioral Health Board is required also to review the draft plan and make recommendations to the local behavioral health county. All right, next slide. And then after that, each integrated plan needs to have a summary of substantive written recommendations that have come from these processes. It also has to include a summary and an analysis of the revisions that were made based on stakeholder feedback. And then the last step, and this is once again only for the final submission of the integrated plan, but our county partners need to receive approval from the Board of Supervisors. Now, prior to that, for the draft that is submitted to DHCS, they need to receive certification from the CAO, and that is outlined in our policy manual on how they can receive that. But then they also have to have certification from their county behavioral health director before submitting that final plan. Next slide. So really also just wanted to outline, because I've been mentioning a lot of different things that have to be included in the integrated plan. And one of the areas that is highlighted in the integrated plan is around the community planning process. And so counties have to document their community planning process. And you'll see here, this is just one example on some of that documentation that they have to provide us around stakeholder engagement. And that's something then that DHCS is reviewing and evaluating to ensure that meaningful stakeholder engagement has occurred. Next slide. And then also, they also have to be describing to us all of those requirements that I kind of just walked through around the stakeholder comment period, the public hearing, all of that. They have to upload their Board of Supervisors resolution or minutes or whatever it is that shows that they have worked with their Board of Supervisors. So that's just some of the requirements, but just wanted to note that this is something then that DHCS will be reviewing. Next slide. All right, next slide. So I've been talking about a lot of resources throughout the presentation, but we have a few more for you. And I do just want to highlight, and I hope I'm not overwhelming you too much, but we're continuing to build out resources, just recognizing this is a really big change in California. And so we've really wanted to make sure that all of you are prepared and have the information that you need. So this is another resource I wanted to highlight today. And so with BHSA, with the requirement around full service partnership, we have instituted in California new levels of care. And so there is a full service partnership adult levels of care comparison chart that really just shows across these different ACT and FACT and the intensive case management, just really helps learn the difference between the different levels of care and outlines the actual key differences for you. So once again, it really helps stakeholders understand, but also for those providing the care, where individuals will be best served, under which level of care, and then of course, which components are in each level of care, and then how those team structures differ. So once again, another really great resource to learn more in this space. Next slide. Another great resource. This is one of my favorite infographics. So if you have not seen this one, I highly encourage you to look at this one. So this really, as I've mentioned, the 30% bucket around housing interventions, that could mean up to $1 billion around housing interventions that's could be utilized by our county partners. And so really helping everybody understand the intersection of the BHSA and that housing interventions and other housing funding. And so really what this does is it outlines the different types of residential settings, the different funding categories. It has just a wealth of information around the settings and the funding sources and how they all intersect. So highly recommend this. We also have, once again, we tapped on our partners at Cal Mesa, and they've put on some housing webinars. So if this is an area of interest to you, would really encourage you to plug into some of those. And once again, those are geared to help our county partners as they're planning out that 30% of funding around housing interventions. And then, of course, we have a lot of FAQs and information available because as we have this funding under housing interventions, we also have housing funding under Medi-Cal community supports. And so there's some frequently asked questions there about that connection and that resource as well. Next slide. All right, thank you. So another really key component of BHSA is to ensure that we're maximizing the use of federal funds that are available through Medicaid. And so this is a requirement under BHSA. And one way to do that is to increase the number of providers that we have that offer Medi-Cal services. And so, just one resource I want to highlight is some recent training that was been provided by Cal Mesa, and it's for our provider partners. So, I'd encourage you to check that out. Of course, we have a lot of resources also on our provider enrollment division that we have here at DHCS that has a lot of resources as well to really help new providers or current providers learn a little bit more about that process. Next slide. And so I've been mentioning a lot of different TA and resources that we've already been lifting up. There's a ton more on our website. So I want to make sure that you encourage you to look at those. But I also just wanted to give you a little small snapshot on some of the county and provider TA that we're going to be rolling out over the next year. And so you'll see here, we have a lot more around community planning, a lot about, I didn't even touch today on the whole other process that we have around community planning, the LHJ CHA CHIP coordination, but there's a lot of TA that we're rolling out in that space that we'd encourage you to keep your eye out for. We're going to be continuing to doing a lot of TA around fiscal policy, but also once again helping our county partners in lifting up these changes, but also understanding the different funding sources and doing a lot of work in the space of helping them maximize the FFP, federal financial participation. So that'll continue. We're going to be hosting some fiscal training, very specific, over the next year as well. We'll be doing a lot around housing interventions, and these are just some of the areas that we're going to be touching on around the integration of SUD, individuals with SUD, ensuring that they have housing as well in this space, as long as they, of course, qualify for BHSA, but other TA around housing, also in just the coordinated entry and then the data collection. We are also going to be doing a tremendous amount around our IT systems and data collection as we continue to roll out new systems that will have some training coordinated with that as well. And then the implementation of our phase 2 measures, and then a lot around contracting, engagement, and then the last one, just highlighting, because we have others as well, but also doing some very specific training around the full service partnership, field-based SUD initiation services. So that'll be rolling out pretty shortly as well to ensure that we are lifting up that new requirement under BHSA. So there's a lot more to come. And one reason I wanted to highlight this today as it relates to the engaging in the community planning process is I just can't overemphasize how important it is for our stakeholders to really understand the whole behavioral health system. This is a very big change in California. There's a lot of, with accountability and transparency comes, a lot of learning. And so we recognize it's going to take some time to understand all these different funding sources in order to, really help our stakeholders have that meaningful engagement. So we're really working hard at DHCS to provide as many resources as we can to help you learn more about the different funding sources, but also about all the various changes under BHSA. So this is just a snapshot. If there's something that's not on the list that you're like, oh my gosh, we need to know about this, this isn't everything. These are just some that we're going to be rolling out that we've already identified. And this is just for the next year. We're going to continue to be providing technical assistance over the course of many years as this continues to roll out. Next slide. All right, so this is kind of our tried and true. So hopefully these are all familiar to you, but I do just want to quickly walk through, as I've been mentioning several times throughout the webinar. We have, of course, on our DHCS website, an area dedicated to behavioral health transformation. All of the resources I've mentioned today are listed there. So please, if you are, can't wait for this slide deck to be posted, you don't need to. You can go there today and learn more about the different resources that I've highlighted. There's also a place that you can receive some updates if you want to add your information there. This is also a place where you can put your questions or feedback at our BHD info mailbox. We also have our public listening sessions where we have been walking through the new policy that's being set. This is another great resource in place if you want to learn about different components of the policy and the changes under BHSA. That would be a great place to go. And then we are also creating a new place on our website around technical assistance and having all of that together in one place as well. So bookmark our site because we have new fun stuff all the time. Once again, in an effort to really help everybody, walk through this incredible change that we're making in California. And so hopefully you'll find this to be helpful. I'm really hoping that today you learned some new things and just have some new tips and resources that you can utilize as you're engaging in that local community planning process. Really thank you for joining me today. Once again, if you have any feedback or anything, you feel free to submit it at our BHT info mailbox. And once again, as I close out today, I just want to thank you. I've seen a lot of folks here today, and I would be remiss not to just personally thank you for all of the incredible effort that you're making under this effort and that you've been making in our fields in California, but continue to make for those in California that are vulnerable populations that really need our help. And so I just want to thank you for all your dedication. And once again, I really hope you found this to be helpful and that you've walked away with some things that you can go and learn about and just get a little more educated and then just really excited for you to be able to participate locally in those engagement opportunities. So with that, I want to thank you and I hope you have a great rest of your day. Thanks. Bye-bye.